This is One on One. We are here at the New Jersey State Nurses Association. These are the EPIC Awards, and two EPIC leaders here. We have Norma Rodgers, the president of New Jersey State Nurses Association, and her colleague, Dr. Benjamin Evans, president-elect New Jersey State Nurses Association. It's a great night. Why?
Because we're recognizing community leaders as opposed to just nurses. So it brings in everyone into the organization, it highlights the organization, and it also helps us to recognize those that give so much back in public service and acknowledge them for all they do in that collaboration efforts within healthcare.
And Doctor, you have such an interesting background. You're also connected to Felician. They have a great nursing program. What drew you to this profession?
I was a young fellow in high school and was drawn to religious life. And so as I went into religious life, I looked at nursing as a career and didn't stay in religious life very long, but I stayed in nursing for 41 years.
Why?
It's just the penultimate career for me. There's so much opportunity. I think that there are so many people that have graced my career, both mentors and leaders, as well as those that I've been fortunate to serve.
Norman, I ask you the same question. The draw.
The draw? My mother was a nurse, so that was my first initial entry into it. And when I came in, it was more so I wanted to help people. I couldn't decide when I was in high school whether I wanted to be a teacher or a nurse. And when I went for my LPN, the licensed practical nurse first, just to make sure I was going to like nursing, I learned that this is where my passion was. This is where I was meant to be. And when I went back for my RN to Bloomfield, I learned that Bloomfield College, that I had leadership skills that I didn't know that they mentored and nurtured and helped me get to where I am today. And the fact that nursing, I went from the bedside over to corporate life, but I'm still a nurse and will always be a nurse and will always continue to fight for and support the nurses. So it's become a passion for me of this is what I was meant to do.
You know, Dr. Norman talks about the leadership side. At the core, what kind of leadership skills are we talking about that nurses they possess, and they use every day?
Well, I think nurses are very organized. They can set up and deliver care. We are often not consulted about the care, but we have been managing the units and delivering quality care for many, many years.
You really are leaders. You really do make a difference every day. But I ask you, the nursing profession has changed dramatically, particularly post the Affordable Care Act. How so?
Because healthcare is actually moving from the bedside out and back into the community. So we're having a shift where we're going to need more public health nurses, we're going to need more community nurses, but still give all of that support that we need for those inpatient. We're trying to make America healthier so that we're trying to do more preventative instead of more curative. So I think the more preventative we can do, the less curative we will have to do. So I think it just shifted where we're doing our healthcare, but still keeping the focus on the patient, the community, and then bringing it all back together once again.
And you're also an advanced practice nurse. Translate.
It's a nurse with a master's or doctoral degree who has an additional 2+ years of training in diagnostics and treatment of certain illnesses. My particular specialty is I'm board certified in psychiatric mental health. And so I see folks with the chronic mentally ill.
Greatest reward of being a professional in this field is?
Being with people.
Most rewarding part is?
Helping others and being able to give back and paying it forward to those that are coming up behind me.
Thank you for allowing us to be a part of a very special night. Thank you, Norma.
Thank you, and congratulations to you as being one of our recipients for this year's EPIC Award. Looking forward to this evening's events.
That thank you goes to all of us in public television who, in fact, are part of this. That is why we are being honored. Fair to say, Doctor?
Yes, indeed. Congratulations, Steve.
We're at the New Jersey Nurses Association, and we're here with one of our EPIC Award honorees, Linda Gable, who is a nurse practitioner in Bloomfield. And your area of practice is psychiatry. Talk about that.
Well, in psychiatry, what we're trying to do is diagnose a problem. If we have to order any labs, we want to rule out any medical problems and then try to find the right combination of medications for the particular patient. So this is an everyday occurrence, and there are so many people out there who have suffered with depression, schizophrenia, and we really just try to be there for them and be non-judgmental because that's a big thing that's important for them because everybody's always judging. But we are non-judgmental, and so we're here to help.
How'd you decide on nursing as a profession?
I decided that I wanted to help people in my community. So I got a little distracted by going into the Army. Then once I got out, I got back on track. And now I'm out there doing what I set out to do, and that's to help people.
But the psychiatry piece, talk about that. What kind of patients are we talking about? What are they, talk about what they're really dealing with.
Well, they're really dealing with a lot of socioeconomic problems, lack of money, lack of education, lack of support in the community. So they may come in with some depression, and then we have some who really come in with more serious problems, schizophrenia or schizoaffective disorder, which is psychosis, and then they're really not really embedded in what's going on in reality. So we really have to try to find that out and get medication for them so that they can reintegrate into society and be productive members.
But the role of nursing in that, someone might say, well, that's what a physician does. Not necessarily true. You're an advanced practice nurse. You play a huge role there.
I do. As advanced practice nurses, I have master's degrees and doctorate like myself. So we have advanced education. We have 4 to 6 years of advanced education. And this is to build us so that we can get to that point. So it's not just physicians anymore. Nurse practitioners, psychologists, there are a lot of us out there who want to help, and we just don't take the physician's same route to provide that care.
Most rewarding part about your work is?
Oh, I love what I do, so it makes it very easy to do. And it's great when I can see somebody go from not being in reality to being in reality, to getting a job, to leading a productive life. That's the most rewarding thing that you can do.
We're here with one of the EPIC honorees. She is Basirah TaHa. She is with Rutgers University Behavioral Healthcare Services. Talk to us about the role of your organization and the impact you have on the people you serve.
Actually, I'm a community nurse, so I actually go out into people's homes and see them in their home. And I'm on the in the APN initiative, which was started by the state to engage.
APN stands for?
Advanced Practice Nurse. And we were 21 counties, 21 APNs were to go out into the homes to engage patients that would normally be difficult to engage. They didn't want to come in for services, but they needed services. So that's what we do.
What do you mean you actually go out to their homes? I mean, who wouldn't come to a particular healthcare facility?
Some people have diagnoses that prohibit them from coming out. If you have agoraphobia or if you have symptoms that make you fearful of others, then you may not want to attend a session at the hospital. So then you are afforded a visit in your home, in your environment where you feel safe, where you're in control.
Biggest misconception about nursing is? Think about it. People think they know nursing and nurses. You say?
Biggest misconception is that we all are the same, that we don't specialize. So if you say a nurse is a nurse is a nurse.
Not true?
Not true. A psych nurse is not an oncology nurse, is not a cardiac nurse, is not a behavioral healthcare nurse. So that's the biggest misconception, that we can all do every job equally. That's not true. We're trained generically so that we can, but then once you get out into the field, you decide what is your passion, and that's what you focus on.
Most rewarding part about your work is?
Helping others, of course, serving the people.
Is that why you got into this?
You want the truth?
I want the truth. We're public television. We want the truth.
You want the truth. Okay. So I was a postal worker and wasn't sure how that was going to work out. And somebody said, you'd be a good nurse. Why don't you try it? So 30 years ago, I tried it, loved it, and here I am.
You made the right call.
I made the right call.
Congratulations tonight.
Thank you very much.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by PSE&G, Wells Fargo, NJM, NJIT, Prudential Financial's Global Communications Department, Verizon, and by Summit Medical Group. Promotional support provided by Commerce Magazine, and by NJ Biz, all business, all New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.